Okay, here we go. Welcome everyone to our weekly Q&A session with Toronto's Associate Medical Officer of Health, Dr. Vinita Dubey. Thank you so much for joining me again today.
Of course, thanks for having me.
My pleasure. My name is Dilshad Burman. I'm a writer and reporter with City and 680 News, and I will be moderating this chat today. Now, the way it goes is we've been collecting your questions over the past few days for the doctor. She's never seen them before. I'm going to present them to her today, and she's going to answer them off the cuff. If you haven't had a chance to submit your questions through our social media pages or our website, you can still do so in the live chat in this broadcast, and we will try to get to as many as we can in the short 30-minute period that we have with the doctor today. So we're going to get started with our cache of questions here. We usually start with vaccine questions these days because they've been top of mind for quite a while, and then we'll get to all of the others as well. So doctor, are you ready to go?
Yeah, let's go.
Okay, wonderful. Let's get started. We're going to start with Rob's question. Rob asks, I've just read that booster shots will be approved for the elderly and those with compromised immune systems. What about those in the 60 to 64-year-old range who were encouraged to get the AstraZeneca shots? Their coverage is not as good as Pfizer or Moderna, and it's not as good as the mixed dose coverage, they say.
Okay, so when we talk about this third dose for certain groups, an announcement is coming today about long-term care, those who have a very weak immune system. We've talked about this before, like who have had a transplant, for example. That third dose is actually like a completion of their series. They actually need 3 doses to get the best protection, where most of us just need 2 doses. Mm-hmm. Now, whether that group needs to be expanded, like to other people who live in the community who are older, that is going to be looked at a provincial level from some of the working groups and also from NACI. So there may be some more guidance down the road.
Okay. And then Shashi has sort of a similar related question. They ask, Israel is already offering booster shots of Pfizer to anyone over 50, and they're currently looking to lower that eligibility to 40 plus to deal with lower antibodies 6 months after vaccination. What is Ontario's plan in this regard? Are we waiting on NACI and Health Canada, and are they in turn waiting for the FDA to see what they do?
Okay, so it's probably actually all of the above, waiting really to see the data. There is data for long-term care. There is data for those who have a very weak immune system, like transplant patients. So some of it is waiting for data. Some of it is waiting for Health Canada and NACI to kind of review the evidence as well and the licensure as well for this. And then some of it is also looking at, is it required? Sometimes we can see antibody responses decline, but it doesn't necessarily mean like you're more likely to get the infection. We do see, for example, in long-term care homes, they have a 2.5%, so far 2.5% of people in long-term care homes who have had 2 doses have gotten COVID. And that is higher than, say, in among all cases where it's been about 0.5%. So it is a bit of a higher risk. And so that's really, we're looking at some of the data points as well.
Okay. And then let's move on here. Kimberly asks, this is interesting. I have a friend who is adamant about not getting the shot and claims that if the vaccinated are getting positive COVID infections and are still spreading the infection, then the vaccine is quote unquote garbage. How do you think I should get through to someone with this thinking?
Yeah, thanks for the question. So I think what we recognize is the vaccines are not 100%, but they're pretty darn good. And they're actually very good at keeping us out of hospital and getting very sick. And so actually data for Toronto that was just released, and we just analyzed, shows that about 85% of people who got COVID in Toronto in the past approximate month were unvaccinated, and 99% were hospitalized, were unvaccinated. So the vaccines work very, very well. They're not 100%, but very clearly will keep you out of getting very sick and in hospital for the most part.
Absolutely. And I think, again, like you said, apart from presenting those numbers, it's normally, you listen to people who are close to you rather than necessarily official numbers or government spokespeople, right?
Yeah, so I think one thing that you need to know is that be confident that yes, the vaccines work. Yes, they, are effective. But then in trying to get through to your friend, try and get through in a way that your friend will understand. And it may not be through the numbers. It may be actually through listening and really understanding them and having that relationship with them that you're more likely to get through.
Right, right. Okay, let's do one more here. Fred asks, why hasn't Health Canada fully approved any of these vaccines? Don't you think that they should declare these vaccines safe? Don't you think that they should declare these vaccines safe and approved before we mandate a vaccine? And if not, what examples are there of mandating a vaccine without full approval?
Okay, so the interim order, which is, some people call that the emergency order in Canada, it's called the interim order. It actually expires in 1 year. So it's going to expire sometime in the middle of September, at which time the vaccines will be considered fully approved. And so the manufacturers are going through that process of providing the documentation that's required for it to be considered approved by Health Canada, not under an interim order.
Right. So when people say things like this is not a fully approved vaccine, it's an experiment, how much truth is there to that, in the sense that, this was done under emergency, this was done rushed? What do we say to people like that who say that?
Okay, well, yeah. So, I mean, there's no question that the interim order was put in place. It allowed an approval process that was what we call, iterative. So when they got one clinical trial completed, they could submit that. They could let them know that the trials are coming. If they required more information, it could be a back and forth. And because we were in a pandemic, there was a lot of global collaboration. There were a lot of global trials as well being done. And so as those were completed, they could submit that information to Health Canada, which is very different from when we're not in the midst of a pandemic. Mm-hmm. But in terms of the approval process, phase 1, phase 2, phase 3 clinical trials, monitoring afterwards, we call that phase 4 clinical trials in real life for the millions of people in Canada who have been vaccinated. There were no corners that were cut there. And so from that respect, the interim order approval was still very consistent with the way vaccines are otherwise approved.
Okay. And then we've got several questions regarding this one particular topic. Sandy, Bob, and Rob all ask, why are more people who are fully vaccinated with the vaccine getting sick with COVID compared to people who have one shot?
So it's actually not true. If you look at the numbers, first of all, the large majority, like in Toronto, 85% almost, are unvaccinated. And then the next group is those who have had one dose, so they're partially vaccinated. Usually they're getting COVID within that first 2 weeks where we know the vaccine doesn't help. And then it's a much smaller proportion of people who have been fully vaccinated, 2 doses, 2 weeks after your second dose. We call that breakthrough infection. A very small proportion are those.
Okay. So that's just simply not true in terms of, people who are fully vaccinated are getting COVID more than those who are partially vaccinated. That's just, the numbers don't bear that out.
It's completely not true. Yes, correct.
Okay, perfect. And then Wings asks, in the new daily provincial COVID-19 cases, are they broken down into hospitalizations for those who are unvaccinated, partially vaccinated, and fully vaccinated? He says this will help encourage people to get vaccinated if they know those particulars.
Yeah, thank you. So I'm not sure that it's being reported on the Ministry of Health's website, though the information is available on Public Health Ontario's website, and Toronto Public Health is looking at how to be able to post that. Like, I've provided some of that information. There was a press release that went out with that information. So we are certainly trying to make it more clear that the hospitalized cases, 99% in the past month or so, have been in unvaccinated people who got COVID.
Okay. And then actually, let's go to some live questions that are coming in on our website right now. They're not necessarily vaccine related, but we'll take them as they come in live. Susan asks, is it safe to go to the dentist right now?
So dentists actually for many months have had precautions in place in order to have that dental experience, which actually can be a necessary experience to make it safe. And, you know, when you're in the dentist office, there can be some of those procedures that are what we call aerosol generating procedures. And that's why you'll see that the dental assistants or the dentists are wearing N95 masks often in those situations. So they're required to follow the guidelines from their society to ensure that it is a safe experience related to COVID.
Okay. Yeah, dentists have been, like, as you said, it's been the case for quite a few months now. And I think we had asked earlier as well, when it comes to safety precautions within the office, they have a number of layers of like public health protocols in place that they must follow in order to do this, right? It's sort of regulated in that sense.
That's right. They must follow them. It comes from their college. That's right.
Okay, perfect. And then let's do another one. I hope I'm pronouncing your name right. A King asks, have there been casual studies of the higher infection rates in unvaccinated people? Could it be for other reasons, such as a very cavalier attitude towards COVID, like they're not wearing their masks, they're not social distancing, along with not getting the shots?
Yeah, it's a good question. I mean, why are unvaccinated people more likely to get COVID? Is it just because they're unvaccinated, or is it because they're, you know, going to crowded settings, for example? Actually, some of the analysis done recently by Toronto Public Health shows that the vaccinated people who get COVID are more likely to have traveled, actually, which is interesting, compared to the unvaccinated. So I think if you go on our website, it shows that the commonest way that people are saying that they're getting COVID is either from close contact from someone they know who had COVID, or through what we call a community exposure. They're out and about in the community. And I think, you know, when you think about that a bit further, are vaccinated people less likely to go to restaurants, go to activities? I'm not sure that they're less likely to do those activities, but they certainly are more protected with that vaccine.
Right. So in terms of those who are catching COVID still, it's not necessarily just the fact that they're unvaccinated, but also likely taking more risks, or are in a profession possibly that is putting them more at risk.
Those other things as well too. But what we can say is that if you're unvaccinated, you're eight times more likely to get COVID than someone who's vaccinated.
Right. Okay. Sorry, doctor. We lost you off the top of that there. Would you mind repeating what you said?
Yeah. So if you're unvaccinated, you're 8 times more likely to get COVID compared to someone who's unvaccinated.
Who's vaccinated?
Compared to someone who's vaccinated. Sorry. Yeah.
Sorry. The technical difficulties are throwing us for a loop a little bit. Okay. Let's go to some more live questions coming in from the website here. T asks, could you provide demographic details about new infections in fully vaccinated people? Are they young or old? Is it a mix? Do they have pre-existing health conditions? How can I be confident in my fully vaccinated status?
Okay, so what we know is that it does vary by age, for sure. We are certainly seeing that the older you are, even if you're vaccinated and you get COVID, you can still end up more sick than, say, if you're younger with COVID. So I think this is the exact reason why we're still recommending that even if you're vaccinated, because we have the Delta variant spreading, we still recommend that you wear your mask, especially when you're in crowded spaces or indoor spaces.
Yes.
Keep your distance to help prevent COVID. I think wearing a mask and getting vaccinated and following those public health measures will give you that extra protection when you're out and about.
Right. And then let's take a couple of live questions here from YouTube. Sarah Gibson asks, how are you dealing with doctors who are giving medical exemptions to people who just don't want to be vaccinated? For example, college and university students. Shouldn't a public stance be given to warn doctors?
Yes, so this is something that has come up, and something that I understand there's going to be guidance for physicians on what is considered a valid medical exemption. Absolutely.
Right. Okay. And so that's under consideration right now in terms of guidelines?
Exactly, and to help guide physicians as well too. There are very few medical exemptions for these vaccines. Surprisingly, but it's true, very few contraindications. Right. There are some, but they are not that many. And so I think we really have to be clear as a physician, if we're giving a medical exemption to someone, that they've either seen an allergist, they've seen a specialist, a cardiologist, if it's because of myocarditis or pericarditis, that they really can't be vaccinated, because as well for the protection of the patient, like if there's any chance that under safer circumstances they could be vaccinated, you want them protected as well.
Right, absolutely. And then I've got a question coming in from Twitter here. Canadian Shield asks, is there a list of known side effects of the vaccines on a web page that people can look up for reference? For example, they say strained neck muscles.
Okay, so there's actually a lot of different websites that talk about the main side effects. If you actually go to the Pfizer Moderna website, they will list all of the side effects that were included in their trial. And then the Public Health Agency of Canada also has very good information on the side effects related to vaccines.
Okay, perfect. Yeah, they're listed. I mean, I think that early on we had an article on citynews.ca as well regarding the various vaccine side effects that are possible and the things that you can be allergic to in those vaccines. Okay, from Twitter once more, Neil asks, if I can still spread the virus when I am fully vaccinated, then how is a vaccine passport useful?
Okay, so again, the vaccines are not 100%. I mean, I love it that people want the vaccines to be 100%. They aren't. We recognize that, but they are very, very good. And so, we know that if you're unvaccinated, you're 8 times more likely to get COVID, which means you're more likely to spread it. So the idea behind a vaccine passport is twofold. One is that it will encourage people to get vaccinated, and the higher coverage rates we have, above 90%, the better off we will be, especially with this Delta variant. And the second is when we have, in certain circumstances, vaccinated people mostly there, you're less likely to spread COVID because we know that. We know that most of the COVID is among unvaccinated people so far.
Right. Let's do one more question from Twitter before I go on to our cache here. Jeff asks, when you get a COVID test, it only tells you if you have COVID, not what type. So how are they determining that all of these people have the Delta variant of COVID?
Okay, so good question. So actually in the back end, the specimen, so to speak, your positive result is going for further testing to determine what gene it is, to determine what variant it is. And if you follow up with your doctor 3 or 4 weeks later, there may be a note on your chart related to your lab results in terms of what the variant was.
Okay, so it is accessible and you can find out which variant you had or if it was good old COVID, so to speak.
That's right. It should ultimately be linked to your own result. That's right.
Okay, perfect. Okay, I'll jump back into our submitted questions here. Parveen asks, as news of decreasing efficacy of Pfizer against the Delta variant is going around, it is making us anxious again. So if we are fully vaccinated with Pfizer, are we safe enough or can we get a breakthrough infection? And if we do get infected, will it be milder?
So if you do get infected, yes, it will be milder. Can you get a breakthrough infection? Yes, but it's much less likely than if you were not vaccinated. And in terms of the efficacy of Pfizer with the Delta variant, again, it's the 2 doses that give you that best efficacy. And that's why we do really want people to get that second dose.
Okay, got it. And then, Doctor, you just mentioned that unvaccinated people are 8 times more likely to contract COVID. Margaret from Facebook is asking if you can provide that study or where people can find that evidence.
Yes, it's from a Public Health Ontario analysis of COVID cases. It also showed that if you're, I believe it's 60 years or older, you're 15 and you're unvaccinated, you're 15 times more likely to be hospitalized compared to someone who's vaccinated. So that's available on the Public Health Ontario website.
Okay, wonderful. So people can go and look for themselves and read the study for themselves. Okay, wonderful. And then coming back to dentists, actually, Robbie says, Will dentists and dental hygienists be included in those who are mandated to get the vaccine? And are any professions mandated at this point, doctor?
Well, we've heard federally that if you're a federal
Yes.
employee, you will be required to get vaccinated. If you work in long-term care, you will be required. And as I understand, there may be some more announcements coming out this afternoon about other workers who may be required. Now, certain businesses can certainly require vaccinations as well for their workers.
Right, but we haven't heard specifically regarding dentists or dental hygienists yet.
We haven't heard specifically, but again, each dental practice is a private practice. So that dental practice could have their own vaccination policy for their own staff as well.
Right, exactly. Okay. And then we've covered this a lot, but it's always good to reiterate this one. Anna asks, is it safe for a pregnant woman to get the COVID-19 vaccine?
Yes, it is safe. And I know that this is one reason why certain workers who are in their childbearing age do not want to get the vaccine. There have been no studies that have, especially human studies, that have linked the vaccine to infertility. And I know that this is making its rounds on social media. It is misinformation. In fact, there's studies that show that there's no relationship, that sperm counts are fine. Keeping a close eye on menstrual cycles, for example. And I think what's really important to know is that if you're pregnant and you get COVID, you can get very, very sick. We saw that with the wave 3. Yeah. And as well, I mean, you want to be alive. You want to be around to be able to look after your children or to have children even in the future.
Absolutely, absolutely. And that's a really dire way of looking at it, but right, for sure, you want to be around. And then doctor, just because we were talking about pregnancy, you've mentioned this before as well. When a mother is breastfeeding, there is a chance for the antibodies that the mother has developed to be passed on to the breastfeeding child, correct?
Yeah, I mean, we know that with breast milk, that antibodies, you know, those good antibodies can go to the child who's nursing, and they can provide what we call passive immunity. And the vaccination can also allow those antibodies to pass to the baby to protect the baby as well.
Okay, excellent. And then let's go to this question from Marguerite on our website. Where can you report possible adverse events if your doctor refuses to report it? They say this happened to them.
So you can actually report it directly to your local public health unit. If you live in Toronto, report it to Toronto Public Health. There is an email address that you can email to, and there's a form to fill out that you can fill out yourself. And whatever health unit you're in, they will do an investigation as well.
Okay, wonderful. So it doesn't just have to be your doctor. You have other options that are, you can sort of go over their heads basically and go directly to public health.
Patients can report directly, yes.
Okay, wonderful. Okay, we have a few more minutes here. Let's jump back into my submitted questions. Hassan asks, I got the first dose of Pfizer and a second dose of Moderna a month ago. Are there any side effects related to that particular combination in the long run?
No, there haven't been any noted side effects for one Pfizer, one Moderna, particularly in the long run. I mean, we do know with the messenger RNA vaccines, sometimes with the Moderna, you can get a sore arm a week or two afterwards, which is a bit different from Pfizer. You know, we call it COVID arm. Some people call it that, yeah. But nothing else in particular. You know, there is the small risk for the myocarditis, pericarditis, especially after the second dose, and especially in young men. But again, that occurs within the first week. It's not a long-term side effect.
Right. And so, doctor, most of these side effects, when it comes to COVID arm, we're talking about myocarditis, we're talking about the other smaller side effects. We're looking at, I believe you said a max of, was it 28 days that we were looking at in terms of all of them, all of the side effects?
Yeah. Classically for vaccines, we say 42 days. So, you know, within 6 weeks following vaccination, if you have a side effect, you can report it. But most of these side effects are occurring within 1 to 2 weeks.
Okay. Okay. Wonderful. I don't know where the 28 days came from, but anyway, there's lots of numbers going around.
Yeah.
All right. And then let's take this one from Anonymous here. It's basically the end of our vaccine questions at this point. What about the Johnson & Johnson vaccine? Is it available in Canada? Because what if you don't want to take Pfizer or Moderna?
Okay, good question. It's licensed, but not available in Canada right now. So, and I don't know what the timelines are for whether Canada will even be getting Johnson & Johnson that we can use.
Okay, so still just waiting on that. Okay, let's go to some non-vaccine questions here. SK asks, does getting a breakthrough infection with the Delta variant allow you to develop Delta-specific immunity?
Yeah, I think it's a good question. I think if you were to get a breakthrough infection, whatever infection you get, I mean, boosts your immune response. And, a Delta-specific immunity, it's hard to know exactly what that means. It means that you had the Delta variant. It's typically immunity to the spike protein, so you're less likely to get it again. We know actually that within 3 months of having had an infection, your immunity is boosted and you're less likely to get reinfected.
Okay, so in all likelihood, you probably are developing Delta-specific immunity, but there's no studies or anything specific regarding that.
Yeah, it's hard to be clear on that, but I think you can see in the latest guidelines for case and contact management in Ontario, if you previously had COVID within the last 90 days, you're considered immune, or if you have 2 doses of vaccine. So that's been added in there.
Okay. Okay, Bob asks, and I don't know if this is true, but these are the numbers they're giving us. Only a week ago, the breakthrough infection rate for fully immunized people was less than 1%. Now it seems to be almost 20%. Is this a concern? So firstly, are those numbers correct?
Okay, yeah, let's explain this. So actually less than 1% is still correct if you look at all COVID cases from the middle of December until now. And the reason why we picked the middle of December is because that's when we started getting vaccines. So if you look at all of the cases, less than 1% of all COVID cases were the breakthrough infection. Now, if we're looking, but that includes a lot of the Alpha variant, a lot of our original COVID virus. And so if we look specifically at the Delta variant, well, the breakthrough infection rate is a bit higher. And that's where we get to, the number that I just shared with you, about 85% of people who are unvaccinated are getting COVID. 15% have had either 1 or 2 doses. So it's a bit higher, that breakthrough infection rate with the Delta variant. But again, it's resulting in milder illness, because remember the other stat I shared with you today, 99% of people who are hospitalized are unvaccinated.
Right. And so, doctor, when they're saying 20%, is it that, so it's less than 1% of total cases are breakthrough cases, and then 20% of those cases are Delta variant? Is that how it's going in terms of numbers?
I don't know where the 20% comes from. I think for Toronto, I can say, 16%, 15% of cases have been in either who have had 1 dose or 2 doses of vaccine for in the last month, and which is really the Delta variant.
Okay. And then we have 1 minute left. And so I'm just gonna take Leslie's question here. How will schools handle lunchtime when school starts? How are they going to keep kids safe during lunchtime when they're not wearing masks?
Okay, so actually today at noon, Toronto Public Health published our guidance for schools. It builds on the Ministry of Education guidance, and in there we have a whole section for lunch, very much recognizing that your masks are removed at lunchtime, and so want, even within the cohort, within the classroom, 6 feet distance between students. And so, either outdoor lunch where you can do that. If it's an indoor lunch and there's not a lot of space, maybe it's every other person wears a mask, half the class eats their lunch, and then you flip it. But yes, absolutely want to take those extra precautions at lunchtime because the masks are removed.
Okay, awesome. And that brings us to 1 o'clock. Doctor, thank you so much for your patience in answering all of these questions for us again today. Thank you to everybody that submitted live. I hope we got to all of them today. If not, we're going to have the doctor back with us next week, so we'll try and get to your questions then. For now, we'll sign off. Thank you so much, doctor.
Okay, bye-bye.
Bye.